and welcome to our very first event in the 15-day Spotlight on Solitary. My name is Emilie Coyle, and I'm the Executive Director of the Canadian Association of Elizabeth Fry Societies. And I'm here with two of my colleagues who are going to introduce themselves next.
Hi, I'm Jennifer Metcalfe. I'm the Executive Director of Prisoners Legal Services in BC.
And I'm Catherine Latimer. I'm the Executive Director of the John Howard Society of Canada. And we're really pleased to be bringing you this spotlight on solitary confinement. And it is no coincidence that it terminates on November 30th, which is the one-year anniversary of the structured intervention units taking effect. I think all of us who care about just, effective, and humane responses to the criminal justice system are somewhat frustrated and disappointed by what we're seeing in terms of how those structured intervention units are operating. And I think that is fueled by a sense that the government kind of billed this as their answer to solitary confinement. Many of us had participated in litigation and other measures to try and overcome some of the abuses in administrative segregation. And what we're finding is that what the UN defines as solitary confinement, which is 22 hours a day in a cell with less than 2 hours of meaningful human contact, is happening all over the place in federal corrections. And I think that's why we're really delighted that this first event is sponsoring or showcasing the report done by Jen's group, which really does indicate the types of solitary confinement that we're seeing in the federal corrections system.
Okay, great. Yes. So the way that this event is going to work is Catherine and I are going to take turns asking questions of Jen. And we're so pleased that Jen is going to be speaking about this report. So Jen, can you tell us, what is the report that you're releasing about, and what really prompted you to write this report?
Well, I guess like a lot of groups, we were concerned about the implementation of structured intervention units and whether it was going to live up to Canada's promise of ending the practice of what they call segregation, but which it did end the practice of segregation in terms of the legislation, but we were concerned about the use of solitary confinement. And we were receiving a lot of reports from clients about being held in conditions of solitary confinement, not just in segregation units or structured intervention units, but in other ways. So we wanted to spend the year focusing on monitoring the reports from our clients about the different ways that they were held in conditions of solitary confinement or other forms of isolation that kind of border on the definition of solitary confinement.
Great.
So can you just tell people, Jen, a little bit about what types of confinement you're talking about that kind of comply with that definition of solitary confinement? I think a lot of people will be unfamiliar with some of them.
Sure. So our report focuses on the use of lockdowns, which is when a warden decides to lock everyone in a unit or in the whole institution in their cells. The duration kind of varies from no time out of your cell at all to 15 to 20 minutes a day to maybe to have a shower or use the phone, to up to 2 hours out of your cell a day, which is the deadline for the United Nations definition of solitary confinement. And so we were able to get a number of documents through access to information and also documents provided from our clients. And so for the lockdowns where the time period that people were allowed out of their cells was recorded, in about 2/3 of the lockdowns, people were held in conditions of solitary confinement. And so we've also, from the data that we were able to collect, it shows that there's been an increase in the use of lockdowns. And in speaking to prisoners and other prison lawyers who have been around longer than I have, it seems that the use of lockdowns has really been on an incline over the last years and decades even. So we're really concerned that the wardens are just able to put people in conditions that the United Nations says can constitute torture or cruel treatment after 15 days or if used against people who have existing mental health problems without any kind of legislative controls. The other kind of isolation that we're seeing in the Pacific region and specifically at Kent Institution, which is the maximum security prison in the Pacific region, is institutional movement routines that are restrictive. So the schedule for all the prisoners, if you don't have a job or you're not in programs or school, at Kent from 2012 until just recently in August, only allowed people in those categories out of their cells for 3 hours a day during weekdays and 6 hours a day on weekends. When COVID came and the programs were canceled and people weren't coming in to provide services, they opened it up to 4 hours a day. So during weekdays, which is not a significant improvement, especially when you don't have access to those kinds of services. So you don't have as much opportunities for meaningful human contact. So, and this is another area where there's no legislation governing it and there's no restrictions on a warden's ability to put people in conditions that border on solitary confinement, where that amount of isolation still has a negative impact on people's mental health. And so then, of course, we looked at structured intervention units and their implementation. And, you know, we were, like many people, were concerned that they still allow for the use of solitary confinement. They say that you should have 4 hours out of your cell and at least 2 hours of meaningful human contact. But the UN definition of solitary confinement is 22 hours of isolation. And so if you're not getting more than 2 hours of meaningful human contact, then that still meets the definition of solitary confinement. And it's come out through Dr. Anthony Dub's report and from our clients reporting that many people, and especially people with mental health disabilities, are not getting at least 2 hours of meaningful human contact a day and are really not getting opportunities to be out of their cell. We also looked at Mission Institution during the lockdown during COVID, which was a really extreme example of a really prolonged lockdown that lasted for more than 2 months, with prisoners in total isolation for the first 8 days where they had no time out of their cells. And then they kind of loosened up the restrictions where people were getting up to 2 hours, but they were still in solitary confinement conditions for more than 2 months. And in the context of the pandemic, where there was a lot of fear and where prisoners' health is already, they're already more vulnerable to COVID, there was a lot of anxiety and fear from our clients who were able to contact us during that lockdown.
Jen, would you mind if we go back a little bit to this structured intervention unit that you mentioned and that Catherine mentioned at the beginning as well? Can you tell people who aren't familiar with structured intervention units what they are, what they were replacing, and what do they look like?
Sure. So structured intervention units were intended to replace segregation after the segregation regime was found to be unconstitutional. And so they seem to have sort of dual purpose of keeping people separate from the population when there's a risk to safety or security. But also, I think there was a recognition with the segregation regime that people with higher mental health needs were ending up in segregation. And so the legislation says that they should be trying to meet the needs of people's mental health needs and trying to explore all alternatives to get them out of structured intervention units. Like ironically at Kent, if you were in structured intervention unit, which is supposed to be the most restrictive form of custody permitted by legislation, you were actually allowed out of your cell more hours than people in the population. And you know, a lot of people said that they had more access to services in structured intervention units. But even with that, a lot of our clients said that, you know, elders or mental health people would come and say, do you want to do programs? Do you want counseling? And they'd say, yes, yes. And, you know, they get all dressed and ready to go and excited about the opportunity, and then no one would come back. And so they would constantly be disappointed and eventually learn, you know, that it's harder to live with that kind of disappointment than to just stay in your cell. The legislation says that you're supposed to have opportunities, not only structured opportunities through corrections, like for programs and things like that, but for tier time. So you should be able to be out on your tier with other people, other prisoners, where you can have an opportunity to socialize or play games. But at Kent, they said that tier time wasn't part of the time out of cell. And so people were only permitted out of their cell and opportunities to interact with others if it was with correctional employees, which as the correctional investigator, I think rightly points out, meaningful human contact really needs to be, like, what is meaningful to a person has to be up to them. And so it's not something that can be imposed by the keeper. So.
Many of the findings that you're coming up with are really consistent with what I'm hearing just from prisoners who've been talking to me about their situation. Many of them say that they found lockdowns to be even more difficult than being placed in administrative segregation, because they lost all right to understand why it was happening to them, to have any kind of due process protections for them being subjected to it. And it really was, it looked kind of arbitrary, that it would be based on things like, you know, shortage of staff or things like that, which you think human resources planning could have taken care of. Are there any things in this report that you found any findings that you found surprising, like startling?
I mean, I think we're constantly not surprised by the way Correctional Service Canada deals with people. So I think that we were kind of, I mean, I was hopeful about the introduction of structured intervention units and the focus on meeting people's needs, but I'm, you know, sometimes have been accused of maybe being a bit naive and hopeful, but and that the history of you know, of how CSC treats people and abuses their human rights just turned out to be consistent, and it's really disappointing. So I can't say that it's surprising, but it's really disappointing. And I mean, yeah, I think something really drastic has to happen.
I think people from the outside would be very surprised at the way people who are ill are treated, particularly the mentally ill, which are shuffled off into very inhumane circumstances. And, you know, it came to light to me the way they treated people who had actually contracted COVID-19 and placed in really abusive medical isolation, as you describe it. I mean, I think people would be very surprised. If you think somebody's in medical isolation, you think they're getting the treatment that they need to address the underlying condition. Boy, that sure wasn't happening as far as I could tell.
Yeah, and I think one of the big problems with the way CSC is run is that healthcare staff are employed by CSC. There really needs to be independence of healthcare. The new legislation has given lip service to clinical independence, but in reality, healthcare professionals are suffering from dual loyalty of their ethical obligations to their patients versus their obligations to toe the line for their employer. And you know, not just during COVID. I mean, I guess COVID is a good example. In BC, the provincial correctional authority, their healthcare is provided through the Ministry of Health, and the way they dealt with COVID was night and day compared to how CSC dealt with it. They had no major outbreaks provincially. They gave people extra snacks, you know, when they had to be isolated. But they didn't use isolation nearly to the degree that they used it federally. And with more people coming in and out quicker, I think that they were at higher risk of a COVID outbreak, but they managed to contain it in a much more humane way. I think the other issue with CSE healthcare and mental health is, and this is also something that our report touches on, is that people with mental health disabilities are often isolated in solitary confinement, even in regional treatment centers, which are psychiatric hospitals. So in the community where the use of isolation in psychiatric facilities is really no longer the norm, or, you know, people are more aware of the harms of isolation and are moving away from that in the community. In prison hospitals, we have clients with really severe psychiatric disorders like schizophrenia just locked up for, you know, pretty much all day for months and months. We have other clients reporting that they can hear them crying out and screaming and banging, and they're just not getting the kind of mental health treatment that I think that they would be getting in the community or should be getting.
And certainly that solitary confinement would exacerbate their mental health conditions, and certainly make them worse, but, you know, potentially. And so it's interesting that you say that you're not very surprised with the findings of your report, but I think for those people who don't work day in and day out with the prisons, I think they're going to find quite a bit of your report surprising. And one of the pieces that we keep touching on in this conversation is meaningful human contact, and the legislative requirement for at least 2 hours of meaningful human contact. And, you know, I understand that that has been largely undefined. And so what would you say is meaningful human contact? And you kind of spoke about what the Office of the Correctional Investigator suggests it should be, but also how do you see keeping meaningful human contact undefined as being beneficial for Correctional Services Canada?
Yeah, like I think one of the most striking things about talking with people in maximum security and in structured intervention units is the environment of where correctional officers have so much control over every aspect of your life, and they're mean. Like, so you can't have meaningful human contact with correctional officers the way the culture is now in CSC. And so when people are isolated so much at Kent with this restrictive movement routine and with all these frequent lockdowns and constantly disappointed, like people, I think, and you know, the research shows that when people are subjected to isolation, they develop anxiety and paranoia. And, you know, a lot of our clients really seem to have post-traumatic stress disorder where they're hypervigilant. So like, I think the really important thing is that people don't feel safe in that environment. And it's really impossible to have meaningful human contact when you constantly feel like you're going to be attacked by correctional officers or other prisoners, and you just don't feel safe. And like, you feel paranoid that people are plotting against you or correctional officers are laughing about you. So yeah, I think it really does need to be defined. And I think there needs to be more follow through when there's promises of services from elders or mental health professionals. And there needs to be more opportunities for people to associate with each other in small groups of people that they feel safe with.
Absolutely. I think that there's a real challenge there and a real sort of missed opportunity to make some progress on that. It's and that's probably one of the reasons why you're suggesting that there should be limits on the amount of time that people spend in these structured intervention units. I mean, if they really were getting the attention and the you know, the time out of cell that they needed, it wouldn't be so bad, but they're not. And I'm just kind of wondering why you've made the recommendation that the period in the structured intervention unit should be limited to 15 days.
Well, 15 days is the limit that the United Nations Mandela rules puts on the use of solitary confinement. So because the current legislation says that people in structured intervention units are to have a minimum of 2 hours of meaningful human contact a day, that's still within the definition of solitary confinement. But I mean, obviously, the changes that need to happen to make sure that people are getting enough meaningful human contact to the point that their mental health isn't suffering, like the changes have to be much more extreme than a 15-day cap, especially with the movement routine being just as bad or almost as bad.
Yeah, and some of the forms of confinement, 15 days is way too long. Like if you were being dry celled or something like that, would be really a real serious problem.
Yeah, that's right. I think there are really restrictive forms of solitary confinement that would require us to think about maybe doing away with them altogether. And so, you know, we see in your report that you've recommended the 15 days cap. Now we understand that that's in line with the Mandela rules, but wondering if there are other recommendations in the report that you wanted to highlight for our folks and make sure that they pay attention to them.
Well, I think the most important recommendation in the report is that there be an independent study of staff culture within Correctional Service Canada at every level.
Here.
I mean, I think we saw a lot of resentment among staff when they were forced to change their use of isolation with the legislation that found segregation unconstitutional. And so, like, no matter how good the legislation seems on paper, it's never going to translate to respecting people's human rights as long as we have officers who think it's okay to slip razor blades under the cell door of somebody at risk of self-harm. You know, and that's just one example of the kind of inhumane treatment that our clients have reported to us.
Yeah. A lot of the concerns that have been raised by some of the prisoners that I've been speaking to have been the verbal goading and and it's not captured on the video, but I think if they had audio, you might very well hear the sort of the demeaning, destructive interaction between the guards and the prisoners. And they only ever capture the prisoner reacting to it. They don't necessarily see what it was that might have provoked an unnecessarily confrontational circumstance. I don't know how you feel about trying to capture the audio as a way of at least highlighting some of the things that might be going wrong in terms of the interaction between the guards and prisoners.
Yeah, definitely. And that's another one of the recommendations is that officers wear body cameras with audio and video in all interactions with prisoners. And I think, you know, when we've asked our clients what they think about that, you know, everyone thinks it's a good idea because that's part of the gaslighting that constantly happens in prison yeah, everything gets twisted. You know, they don't want to talk to anyone because everything they say is going to be used against them. And they say they made requests and the officers deny it. And, you know, every time there's a credibility competition between a prisoner and an officer, the officer wins. And so body cameras with audio would eliminate that problem. And I think it would reduce the amount of conflict and uses of force and everything substantially.
Over the next 15 days, I think we're going to have an opportunity to really bear down and shine a greater light on some of the areas of confinement that you have highlighted. But I know people will want to read your report. It's an excellent report, and it really, you know, raises the full gamut of issues. Where can they get a copy of the report?
Yeah, our report will be made public on Monday, the 15th, so they can find it on our website, which is prisonjustice.org.
That's great.
Wonderful. And thank you, Jen, for doing this important work and for joining Catherine and I today for this discussion.
Thank you too for
Great
this
job.
excellent initiative.
Thank you very much.
Okay, well, thank you to everyone for joining us today for this first event. And we have events happening daily throughout the next 15 days. So you can register on Eventbrite by searching for Spotlight on Solitary. And you can also follow Spotlight on Solitary hashtag on social media for more information and announcements. And we will also be putting the link below this video so you can link to it directly from there. Looking forward to seeing you at the other events.